I also just wanted to do one last thing before turning it over to the governor to talk about something you have all been tracking with us very closely. And that is the disproportionate impact of COVID-19 on certain racial or ethnic groups in California. And on this slide, you will see the blue line or the blue bar is the percent of that ethnic or racial group in the population of California. The orange bar is the number or percentage of cases among all COVID-19 positive cases in our state as it relates to that race or ethnicity. And then the gray is the deaths. And when we look at that, you see two things that come out, and we reiterate it. We're going to keep looking at it together with you as a state, and that is around Latinos. We see a higher, disproportionately higher number of cases. And this requires us to continue to work with our Latino partners, our counties across the state, to determine what other efforts and interventions are needed. For example, do we need to bring more testing so that it can be available earlier and often? Do we need to increase our capabilities around contact tracing and ensuring that we can support isolation and quarantine when necessary? Similarly, among African Americans or blacks, you'll see that there's a disproportionately high number of deaths relative to the number of cases, and even relative to the population throughout California. And again, this requires us to look closely and work with the black communities across California to ensure that we have testing. We know across the nation seems to be a trend that African Americans are showing up for testing much later in the course of COVID-19. And what that means is when we finally get someone to care, that we have, they're sicker and we have a longer way to go to help them get back to health. And so those focused efforts are things that California is working hard on to ensure not just that treatment and ventilators and staff are getting into neighborhoods and communities where we see additional cases, but that things like testing and contact tracing continue to be a focus. And collectively across California, we continue to make gains in this space, but we will persistently and in an ongoing way share this information with you all so you can track with us our efforts and whether we're seeing the impact we expect in California.